Don't ignore this. When your kidneys start to fail, it's not just waste that builds up. Important substances that your body needs start leaking out. And this imbalance begins to damage your heart, weaken your bones, and in severe cases can be life-threatening. So in this video, I'll show you how to reduce the burden on your kidneys by managing the most important nutrients. First nutrient is sodium. Most sodium comes from table salt. If you cook at home, you have more control over how much you can add. But if you're eating processed, packaged, or restaurant food, you likely get more sodium than needed. Sodium is not bad. It helps regulate fluid balance, maintain blood pressure, and supports nerve and muscle function, including the heart. But when the kidney function declines, they cannot remove excess sodium effectively. As sodium builds up in the body, it causes the body to hold more water, which increases blood pressure, puts more load on the heart, and makes the kidneys work harder. The recommended intake is around 1500 to 2000 milligrams per day. The problem is not sodium intake alone, but the body's reduced ability to remove it. So if you have kidney disease, it becomes important to limit excess sodium, especially from hidden sources, such as processed foods, pickles and salted foods, packaged snacks, restaurant and fast foods, instant soups and mixes. Try to limit or avoid these depending on your condition. Instead, prefer low sodium foods such as rice, pasta, or quinoa. Vegetables like red bell peppers, cauliflower, cabbage, onion, radish, turnips, and broccoli. Second nutrient is potassium. Potassium plays a very important role in nerve function, muscle contraction, and maintaining a normal heart rhythm. The recommended intake is about 3400 milligrams for men and 2600 milligrams for women. Natural sources include banana, potato, dried fruits, beans, and lentils. Some processed foods can also contain high amounts of potassium, such as potato chips, French fries, processed chocolate, and tomato based sauces. Healthy kidneys remove excess potassium from the blood, and when kidney function declines, this ability is reduced. As a result, potassium can accumulate in the blood, and at high levels, it can disturb the heart rhythm, and in severe cases, it may become life threatening. Whether these foods need to be avoided or limited depends on your blood potassium levels. Your doctor or dietitian can help create a personalized plan. Third nutrient is phosphorus. Phosphorus is a vital mineral important for bone and teeth health, energy production, and proper muscle and nerve function. We need about 700 milligrams per day. Natural sources include milk and dairy products, meat, fish, and eggs, nuts and seeds, beans and lentils, and whole grains. However, many processed foods contain phosphorus additives. Unlike natural phosphorus, these additives are absorbed almost completely by the body. This means processed foods can raise phosphorus levels much more quickly. Healthy kidneys remove excess phosphorus effectively, but when kidney function declines, phosphorus begins to accumulate in the blood. This can lead to weakening of bones, itching of the skin, calcium deposits in blood vessels and soft tissues, and increased risk of heart disease. Doctors may recommend limiting foods high in phosphorus and avoiding processed foods with phosphorus additives. Fourth is protein metabolism waste. When your body uses protein, it produces waste products such as urea and creatinine. Healthy kidneys efficiently remove these waste from the blood, but when kidney function declines, these waste products begin to accumulate in the body. This can lead to symptoms like fatigue, loss of appetite, and a general feeling of illness. Too much protein increases waste buildup, but too little can lead to muscle loss, so the right balance is the key. For many patients, protein intake is usually kept around 0.6 to 0.8 grams per kilogram of ideal body weight, depending on kidney function and medical advice. Prefer high quality protein sources such as dals and lentils, low fat dairy, eggs, and excellent plant protein sources like tofu and soy. It is important to distribute protein evenly across meals rather than consuming large amounts at once. Always consult your doctor or dietitian to determine the right type and amount of protein for you. Next is fluid. Fluid doesn't just mean water. It includes everything that becomes liquid in the body. Fluid includes water, tea, coffee, soups, juices, and even watery fruits. Healthy kidneys maintain the body's fluid balance by adjusting how much water is removed in urine. When kidney function declines, the body may begin to retain excess fluid. This can lead to swelling in the legs and feet, fluid accumulation around the lungs, increased blood pressure, and breathing difficulty. For people with early stage kidney disease, fluid intake usually does not need strict restriction. Most patients can drink about 1.5 to 2 liters of fluid per day, depending on their body size, activity level, and climate. However, if kidney function declines further or swelling develops, doctors may recommend reducing fluid intake further. Healthy kidneys filter about 180 liters of blood every day, removing what the body does not need and returning what it does. This delicate balance is what keeps us healthy. And when kidney function declines, this balance is disrupted. By understanding what to avoid and what to limit, you can reduce the burden on your kidneys and make them last longer. If you have diabetes, high blood pressure, or consistently high creatinine levels, I strongly recommend that you sit with your doctor or dietitian to create a personalized plan. I hope this video was helpful. Thank you for watching Nutritional Perspective. I'll see you in the next video.